How to use a digital BP apparatus. This training video demonstrates the correct usage of the digital BP apparatus, including identifying its parts, preparing the patient, measuring blood pressure, and ensuring safety precautions. Let us first understand the main components. Monitor, MEM button, start/stop button, set button, air tube, cuff. Cuff wraps around the patient's upper arm. Air tube connects the cuff to the machine. Display screen shows the BP and pulse readings. Start/stop button to begin or stop measurement. Set button for settings like date and time. MEM button to recall previous readings. Now, let us see how to use the digital BP apparatus on the patient. Before taking the reading, ensure the patient is seated comfortably with the back supported and feet flat on the floor. The arm should rest on a table at heart level, and the patient should relax quietly for 1 minute. Tight clothing around the arm should be removed. First, wrap the cuff around the patient's upper arm, about 2 to 3 centimeters above the elbow. Keeping the air tube aligned with the brachial artery. Ensure the cuff is snug, not too tight. Next, press the start button. The machine will begin measuring automatically. The cuff will inflate and then slowly deflate. Instruct the patient to remain silent and still during this process. Once the measurement is complete, the monitor will display the systolic pressure, diastolic pressure, and pulse rate. Note these values carefully. Finally, remove the cuff gently and sanitize it before using on the next patient. Now, let us look at some important safety precautions to be followed. Always sanitize the cuff before the next use. Do not measure BP on an arm with IV line, injury, or fistula. Ensure the patient is relaxed and silent during measurement. Report unusual or critical readings to the doctor immediately. Store the device in a clean, dry place.